Ovulation is a part of the menstrual cycle when the ovary releases a ripe egg, or ovum. Inside the ovary are hundreds of thousands of follicles. Each follicle is a hollow ball of cells with an immature egg in the center. The typical 28-day menstrual cycle begins on the first day of menstrual bleeding. During the first 7 days of the cycle, a few follicles begin to grow at the same time. These maturing follicles secrete estrogen hormone into the bloodstream to prepare the lining of the uterus for pregnancy. Around day 7, all of the follicles stop growing and begin to degenerate, except for one. This dominant follicle continues to grow and nourishes the developing egg inside it. Around day 12, the follicle secretes a large amount of estrogen into the bloodstream. When the estrogen reaches the hypothalamus and the pituitary gland in the brain, the anterior or front part of the pituitary gland releases a huge surge of luteinizing hormone into the bloodstream. Around day 14, luteinizing hormone causes the follicle to undergo a sudden growth spurt. Right before ovulation, the egg detaches from the inside of the follicle. The bulging follicle releases chemicals, causing one of the two fallopian tubes to move in closer and surround the follicle. The follicle swells until it bursts open, ejecting the egg and fluid from the follicle into the abdominal cavity. In response, the fimbriae, tiny projections at the end of the fallopian tube, sweep across the ovulation site and pick up the egg. Microscopic cilia on the fimbriae's surface transport the egg to the entrance of the fallopian tube. Inside the walls of the fallopian tube, muscular contractions gently push the egg towards the uterus. After ovulation, the egg lives for 12 to 24 hours, so it must be fertilized by a sperm from the male during this time for a woman to become pregnant. If it's not fertilized, the egg dissolves away and is shed along with the uterine lining during menstruation.
A primordial follicle consists of an oocyte surrounded by a single layer of squamous granulosa cells. A primordial follicle becomes a primary follicle as the granulosa cells become enlarged and cuboidal. The primary follicle enlarges, and the granulosa cells form more than one layer. The zona pellucida forms around the oocyte. The structure is called a secondary follicle when fluid-filled vesicles develop among the granulosa cells and a well-developed capsule, or theca, becomes apparent around the granulosa cells. The theca possesses internal and external layers. The structure is called a mature follicle when the fluid-filled vesicles form a single antrum. At full maturity, the oocyte is located in the cumulus mass. During ovulation, the oocyte is released from the follicle, along with some surrounding granulosa cells of the cumulus mass, called the corona radiata. Following ovulation, the granulosa cells divide rapidly and enlarge to form the yellow corpus luteum. When the corpus luteum degenerates, it forms the white corpus albicans.